choosing the right inflammatory marker. There are so many inflammatory markers, and they should be chosen in light of the clinical data, that is history and physical examination, and what is your provisional clinical diagnosis. The inflammatory markers can be serum or plasma or blood-derived proteins, enzymes, or cell counts that have independent diagnostic and prognostic value. Representing an underlying disease state, they can be cytokines and acute phase proteins as well. So of these different type of inflammatory markers, one has to choose according to the clinical scenario. So if we are suspecting that patient has an infection, we can go for CRP, ESR, and if you're considering this may be a bacterial infection, so we have to differentiate between bacterial and viral infections. For example, in the epidemic of COVID, it's a viral disease, but if the symptoms persist and the patient has respiratory symptoms pointing towards a pneumonia, a procalcitonin may be very important in telling you that patient might have a superadded bacterial infection. So procalcitonin is important, and cell counts are important. You may find neutrophilia, you may find neutropenia, lymphocytosis, lymphocytopenia, monocytosis, eosinophilia. So these are very important cell counts. They can tell us about the presence of some type of infection. For example, some of the viral infections like dengue may present with neutropenia, while gram-positive sepsis may present with neutrophilia. So these may be very helpful, and depending upon the clinical scenario, we can request these tests. And then mannose binding lectin. This may be increased in bacterial infections. Sometimes it is also increased in autoimmune conditions. So these may be the markers which you may be requiring when you're considering sepsis as a possible cause of problem. And if you're considering inflammatory conditions like SLE, rheumatoid arthritis, inflammatory bowel disease, we can go for CRP, we can go for ESR, and we can go for plasma viscosity. And in patients who are critically ill, we may go for procalcitonin on leukocyte count. And in patients where we want to monitor the disease response, CRP is a good investigation because CRP very rapidly changes with the inflammation. So if the inflammation is worsening, it is going to increase, and if the inflammation is improving, this starts improving. So that's a very good test. And now in the context of malignancies, remember, in malignancies, inflammatory markers are not very important. The important thing is either the tumor markers or the imaging of the malignancies. The image is showing the patient's tumor burden is decreasing or not decreasing, or the tumor markers. So inflammatory markers may not be very useful in following patients who got malignancies.